Hello, this is Group 322 and our topic is pertussis, or in simpler terms, whooping cough. Pertussis is an acute infectious disease of the respiratory tract, which is caused by the bacterium Bordetella pertussis. Bordetella works in a number of different ways to bring about the symptoms of whooping cough. In the bronchi, bronchioles, and nasopharynx, Bordetella pertussis damages the ciliated respiratory epithelium through the production of toxins. It is able to paralyze the cilia and cause local tissue damage and inflammation, which leads to compromised mucus clearance. Bordetella pertussis also inhibits phagocytic functions, increases insulin secretion, and causes lymphocytosis to occur. These combined factors work to decrease the diameter of the airways. Symptoms of whooping cough are usually similar to that of a common cold and can be characterized by sneezing, a running or congested nose, and sometimes a mild cough or fever. However, after 1 to 2 weeks of pertussis, the notorious whooping cough can begin. This rapid, violent coughing can last for several weeks and is usually worse at night, where it is often followed by vomiting. In severe cases, the affected individuals may experience pneumonia or cracked ribs and may even be hospitalized. Interestingly, although the cough is usually the most characteristic symptom of pertussis, young infants who are affected may not experience the cough, but instead apnea, where they stop breathing for a period of time, or cyanosis, where the skin and mucous membranes take on a bluey tone. If you as a parent or caregiver notice any of these symptoms, it is important to seek professional advice as soon as possible. Firstly, because pertussis is highly contagious for all ages. Secondly, there are a number of other health complications that can arise and are often life-threatening. These complications tend to fall under 3 categories: respiratory, neurological, or lifestyle complications. Respiratory complications include pneumonia and brief periods where breathing stops. Neurological complications include seizures, fainting, and encephalopathy, which is loss of brain function. Lifestyle complications include loss of appetite, sleep disturbance, and middle ear infections. The worst possible outcome if pertussis is left untreated is death, due to the severe bodily malfunctions that arise from the complications. So if your child or patient has been diagnosed with whooping cough, how can you treat it? The least expensive evidence-based approach to treating pertussis is to take a course of antibiotics. This form of treatment is most effective when it is administered within 21 days of experiencing the general symptoms of pertussis. A second treatment for pertussis is vaccinations, which not only help to treat but also to prevent the disease. Vaccinations are usually the recommended treatment for patients as they are considered the most effective way for pertussis to be controlled. However, if your child or patient has already started experiencing the complications that arise from pertussis, your expenditure on care may tip towards the higher end of the spectrum. A machine called an extracorporeal membrane oxygenator, or the ECMO, can be used as a temporary substitute for the heart and lungs to support cardiac and respiratory function while the body heals. Unfortunately, there is no exact cost figures for this treatment, as it varies for each individual patient. However, procedures like this, which must take place in a hospital, require expensive medical equipment and are thus known to be costly. In summary, pertussis is a disease that portrays itself similar to a common cold. It is important that you seek medical attention as soon as symptoms arise, or even if you suspect that your child or patient has whooping cough. This is because pertussis is highly contagious and can be deadly.